Now, Ghana is one of 3 countries in Africa to start the piloting of malaria vaccines. This initiative is to help save the lives of tens of thousands of children who die of malaria on the African continent. The World Health Organization on Tuesday joined the Ghana Health Service to launch the National Malaria Vaccine Implementation Program in Cape Coast. Country Director of the WHO, Owen Kalua, says the launch of the program should come as a good news to the country because Ghana, like many other African countries, has been and is still being hit by the devastating effect of malaria. Richard Kwejonya has more.
The WHO estimates that about 400,000 deaths on the African continent are recorded every year as a result of malaria. Owing to that, an aggressive pursuit of solutions to this disease that has hit and continues to hit largely people on the African continent was done, and a vaccine was found. After a series of trials, the pilot implementation of the vaccine begins in 3 African countries, including Ghana. At the national launch in Cape Coast, Country Director of the WHO, Owen Kalua, was upbeat the breakthrough should end the woes and miseries of many a Ghanaian.
WHO welcomes the government of Ghana's launch of the malaria vaccine, which has the potential to save tens of thousands of children's lives. This breakthrough in malaria control caps a 30-year effort to develop a vaccine with proven results to prevent malaria in young children. It represents a dream come true for many, for the scientists, public health experts and leaders, healthcare workers, community advocates, public and private partners, and the people, children and families who have suffered from this disease. The disease saps our productivity, prosperity, and potential. It keeps our people in poverty and drives families into poverty.
Director General of the Ghana Health Service, Dr. Anthony Siasari, spells out how the implementation is going to be done in Ghana. He warned against misinformation and peddling of falsehood against the program to enable Ghana come out of the shackles of malaria.
I want to repeat here, this is a pilot implementation. It's not clinical trials. The technical working group, in collaboration with key stakeholders, including selected representatives from the regional health directories, using multiple and strict criteria, selected 3 regions then, but now 6 regions, namely Volta and Oti regions, Bono, Ahafo, we chose Ahafo, Bono and Bono East regions, and Central region. And we are using Upper East region as a post-market survey, where we found ourselves to be the largest target regions for the malaria vaccine implementation program. The Ghana Food and Drugs Authority has given authorization for the vaccine to be used in these targeted regions for the pilot introduction. We are fully aware that sometimes fear and misinformation can make communities wary of vaccines altogether. And we are also aware there are some anti-vaccination groups, especially on social media, who always talk as if vaccines have been brought to Africa to sterilize all our children. We must therefore guide against the misinformation and the fear of usually associated with introduction of new vaccines.
Central Regional Minister Kwame Duncan has been preaching about attitudinal change. He says the country might face challenges battling with malaria if our sanitation laws and building planning laws are disregarded.
Our own attitude, way of life, and all of that has never helped this agenda. That in building our communities, it is haphazard. Anything goes. Shanty towns where the environment is not properly developed. When rain falls, you have puddles. And these are the conditions which promote the vector, the mosquito. And so, the effort by Ghana Health Service itself must go alongside a certain collaboration, multidisciplinary, multi-sectorial.
The Global Malaria Program has already declared 2030 for the end of malaria. Richard Kwejonya, JoyNews, Cape Coast.